Officials from both the Nelson Mandela Bay municipality and the Sarah Baartman district municipality say new coronavirus cases have a potential of getting out of hand. They met with Health Minister Dr. Zweli Mkhize today in Port Elizabeth. Now, the province is starting to see a surge in COVID-19 cases once again. Newzroom Afrika's Malungelo Boy is in Port Elizabeth for us. A very good afternoon to you, Malungelo. There seems to be a sense of apprehension and concern coming from the minister regarding the Eastern Cape and a possible resurgence there. What have been his sentiments so far during his visits?
Perhaps, Tammy, let's start with what we're actually currently seeing in front of you. I'm going to move away from the shot. Those are some of the community health care workers from this particular region that are protesting outside the venue where the health minister, Dr. Zweli Mkhize, in fact, is actually meeting with some of the health officials from this province, but also from the Nelson Mandela Bay municipality, as well as Sarah Baartman district municipality, and of course already officials from both these municipalities raising concerns, Tammy, about the number of new COVID-19 cases that these particular areas or these particular municipalities are starting to see. For example, where we are in the Nelson Mandela Bay municipality, officials are saying that a day in the past few weeks, in fact, they've been seeing about 400 new cases of coronavirus. Bear in mind, Tammy, that the province alone is seeing about 1,000 cases of new coronavirus cases. Nationwide, that picture is about 2,000, and already officials saying that they are worried about this, and that really points to people not adhering to those COVID-19 regulations, safety protocols, wearing of face masks, and as well as safety and as well as keeping, that social distance. And of course, though, the health minister also saying he is worried about those cluster breakouts of coronavirus in these two areas, in fact, that's the Sarah Baartman district municipality and as well as Nelson Mandela Bay municipality, saying that this will need aggressive response. Let's take a listen.
We are very concerned about the numbers as we see them in the Eastern Cape. There was a time when the whole country was going through a surge, which was around July, August, and the numbers came down to a plateau. Most of the provinces that have still got high numbers, such as Free State and Northern Cape and Limpopo, they're basically still trying to come down from the first wave. But Eastern Cape is different. We're now starting to get new cluster outbreaks. These cluster outbreaks that we're seeing are an activity that is new, that is showing increases that are higher than where we were after we'd come down to a plateau. So effectively what this means is that there are cluster outbreaks that we have to manage aggressively. If we don't do so, that's the beginning of the pandemic getting out of control, probably shooting up again towards the second wave.
Malu, if you could just once again recap for us why it is that the health workers behind you are protesting today, and also just point to some of the concerns that the minister himself had about the availability of adequate nursing staff.
That's right, Tammy. So the workers that you see behind me are members of Nahawu. They are community healthcare workers. Essentially, these are people, Tammy, that go into communities and deal with COVID-19 face to face. So some of their concerns really are that they want to be employed permanently. When I was talking to one of their leaders saying that these workers have been working part-time for as many years, saying that it's time for government to absorb them into the system, because obviously these are the workers also that are dealing with coronavirus, saying that it can't be right that people are working, have been working for the health department for so long, but are still not on permanent contracts. And of course, the issue of healthcare workers coming into sharp focus in the meeting that took place earlier, or that is still taking place inside that venue that you see there. And of course, we're hearing that some of the healthcare workers that have been dealing with COVID-19 in this province and in this region, we're told that some of them are actually quite fatigued. In fact, we have been told in the past few weeks over 100 workers in the Nelson Mandela Bay municipality contracted COVID-19 and are currently in isolation. The minister also spoke to that particular issue of workers being fatigued. Let's take a listen.
When it comes to the issue of nurses, I'll need a much more granular report. We had increased the numbers of nurses that had to be employed during the surge. So I need to know what has happened, because I have heard that we have lost some of the nurses on a simple basis of the usual migration. If permanent posts appear in another province, they'll simply leave the contract and go into the permanent posts, and so that becomes some of the challenges that we have to face. But I think we need to then get a clearer report. But where there is a challenge of the shortage of nurses, that needs to be addressed. Now we need to then talk about what challenges you face in addressing that shortage. That is the first and easier issue that I think we need to be dealing with. The second issue relates to capacity to test. The turnaround times should not be delaying as what is being reported, because we are not testing as much as we're testing during the surge. There has been a discussion since we got your report with the Director General and the CEO of the National Health Laboratory Services to increase the capacity for testing in your laboratories.
Malungelo, thank you very much for that update coming to us from a rather rainy Port Elizabeth. We'll touch base with you as the afternoon progresses, and you keep dry there. That's our Malungelo boy, who is with the Minister of Health, Dr. Zweli Mkhize, as he does a tour of the Eastern Cape today in Port Elizabeth.